Hey guys, Dr. Kalantari here. I was just wanted to touch base with you guys and talk a little bit about Invisalign and braces and kind of all the questions that I tend to get in our office about those two things, primarily Invisalign. So I guess first, it's probably best to talk about what is Invisalign and how is it different than conventional braces. Everyone knows and remembers, the conventional braces with the brackets and the wires. Kind of like this guy here, where each individual tooth has a bracket on it and then the wires attached to it. And there's a time and place for these. I'm not going to say that there's not, because all patients are not a candidate for Invisalign, but Invisalign's come a long ways, and I'm excited to offer it at our office because of that. Invisalign is considered an aligner, and so what that means is rather than having the wire and the bracket and everything kind of attached to the teeth, we have basically a plastic tray that fits over the teeth, kind of like this. So if you kind of look there, it just snaps into place, real snug and nice. Now, the thing about Invisalign that I really like is the attachment process. And so what that means is, where conventional braces always had an advantage was they could control each tooth, right? Because we have a bracket and it's attached directly to that tooth. Where aligners sometimes were failing was because the plastic had to do all the movement. Well, the cool thing about what Invisalign has done is they've developed attachments, which actually are little bumps of, basically composite filling material that we bond to the tooth, and those little attachments serve as our bracket, which I think is really awesome because they've really honed in and designed them so well to really understand the forces and mechanics of tooth movement, and so we're really able to control the teeth a lot better with an Invisalign with attachments than we were before. So we've come a long ways, and I tell a lot of patients, a few years ago, if you'd asked me, what's better, Invisalign versus brackets, I probably would have said brackets. I just had a lot more control. I had a lot more movements that I could do with the brackets and the wires. Now with what Invisalign, and the kind of technology that they've developed, I'd say probably 80% of my patients go into Invisalign trays versus conventional brackets and wires. And I'll tell you, I was not that gung-ho about it to begin with, but it's come a long ways, and I've actually been quite impressed with that. And so, one of the other big questions that people often ask me is, cost, of course. Cost is always a big factor. And so in our office, it varies because obviously everyone's crowding, everyone's spacing, everyone's orthodontic needs vary. And so that, we have a range. Generally, the lower end is about $3,000 and all the way up to $5,500. And that all depends on, how long the treatment's going to take, the types of movements that need to be incorporated. I've had patients that only need 5 to 10 aligners, and obviously cost-wise, that's, we pass the savings on to you. But sometimes, I've had patients that go to 40, 50 aligners and it takes, quite a while. So, that's another thing is time frame. How long does it take? When we're talking about, easier movements, and don't get me wrong, just because it's an easier movement doesn't mean it's an easy thing to accomplish, and, we can use a less subpar aligner, but if we're talking about easier movements, we can generally do that a little bit quicker. So, I think the shortest is probably just 2 months, maybe 3 months, as far as getting the perfect movement and getting everything lined up right. But when we're talking about bite changes and, more advanced things like that, obviously those things take a while. And if we're, incorporating the back teeth into that, and, it just adds on to the plan. So I'd say, sometimes, I think the longest that I've ever had was about 1.5 years. Now, when it comes to cost as well, insurance always comes into play. So people say, oh, insurance isn't going to cover this for me. Well, that's not necessarily true. Invisalign is considered to be the same as conventional orthodontics. So if you do have orthodontic coverage in your plan, then of course we are going to try to fight for that with the insurance company and get you as much help and coverage as possible. And I've seen some insurance companies cover up to $2,000 with the insurance plans, and every plan varies. Sometimes there's an age limit, sometimes there's not. It's just once in a lifetime. So that's obviously something we'd be happy to go over with you and kind of figure out with your insurance company to see if that's an option for you. And then in terms of taking care of the remainder of the cost, we always offer payment plans if you need it, just to kind of help spread out the cost a little bit, because we understand it is an investment, but we think it's an important investment because for us, as dentists, not only are we talking about the cosmetic and making your teeth look pretty, but straight teeth and overall proper bite is the foundation of your mouth, right? So if we don't have that correct bite and teeth are wearing improperly, then long term we can have bigger problems that hopefully we can avoid by addressing them with the orthodontic treatment. So as far as evaluation goes, generally what we'll do is we'll do a full thorough evaluation of the mouth. We always want to make sure that there's no other problems going on. You never want to get into treatment for orthodontics if you have bigger fish to fry. So that's always going to be the first thing we address, and then really we got to do a deep dive and see if you're a great candidate for aligners, because sometimes some patients those movements are just so pronounced. Now I will say we've come again a long way, so we can do a lot more than we did before, but it's never 100%. And unfortunately, my biggest thing is I don't want any patient to go in with higher hopes than should be realistic. So if there is something that stands out as being not getting the perfect result from aligners, we're always happy to refer to some of our great orthodontists who can do or use conventional orthodontics in our own office to get the results that we need, because ultimately what's the point if you're not going to get the perfect result? Because we're here to make sure that everything is perfect and that you're happy with your teeth for the long run. And that's another thing is when we're talking about retainers and how long will this last? Well, orthodontics in general, it's important that you wear your retainers for, as I tell patients, as long as you want your teeth to stay straight, because when it comes down to it, those teeth, they were happy wherever they were, when they were crooked or spaced out or spread out, and so they tend to want to try to shift back, and no type of orthodontics is ever going to change that. And so once we're done with the braces, the Invisalign, whatever it may be, your job is to stay on top of the retainer wear and make sure that you are diligent about that, because ultimately that's the best way to maintain your investment and keep your teeth in that perfect position. And the cool thing about what I prefer when it comes, speaking of retainers, is Invisalign generally comes with a retainer that's styled like their Invisalign trays. And the importance of that is they cover the teeth completely, right? So we all remember, growing up, we'd see our friends and they had those big pink guys with the wire across, and there's a time and a place for those guys, or the fixed retainers that people glue to the backs of their teeth. Those are fine too, but ultimately, I find the least amount of movement and the least amount of what we call relapse or going back to where we were, teeth-wise, occurs with these clear plastic trays that serve as the retainer. So I'm a big proponent of the clear plastic trays, whether you use conventional orthodontics or Invisalign. And so I guess we'd be remiss if we didn't talk a little bit about Smile Direct Club, because that is the big hot button item when it comes to aligners right now. And Smile Direct, I have some patients that come in and ask me about it. And the thing that I appreciate about Smile Direct is it brings a lot of awareness to orthodontics to people that may have not thought about it before. So I'm not going to say it's all a bad thing, but what I will say is there's a lot of difficulty and a lot of control and a lot that goes into the designing of these cases, because when you're talking about aligner therapy, you're talking about something that takes quite a while and it's a very intricate thing. It's not simply just pushing plastic on teeth and everything falls into place. And so there's a lot of back and forth that goes between myself or the dentist and Invisalign in terms of making sure that everything moves in the proper way. And that's something that's kind of skipped in Smile Direct Club. That yes, they do have people that oversee the case and design it, but sometimes when you get to be too bulk or mass market, sometimes it's a little tough to customize treatments as well as I think our patients deserve. Another thing is the impressions, right? The impressions are the basic beginning of the case. So if we don't have proper impressions, that sets up the rest of the case for failure. So for me, I'll tell you, impressions aren't easy. There are many times that my assistants who take impressions, all the time, they do a better job than I do, and I praise them for that. And to the thought of trying to take good quality orthodontic impressions in my own mouth without any training or with somebody who may not, have the oversight or understanding of what's a proper impression, that's a little scary to me, right? So that's that because if we don't catch that at the beginning and we don't send that perfect impression, then how do we know we're putting the proper movements on the teeth and moving everything? So that's a couple of areas of concern with Smile Direct that just comes to mind. But this isn't about Smile Direct. This is primarily about Invisalign. So if anybody has any questions, of course. Going back to, well, I should say, with the Smile Direct thing, we do have a blog that kind of addresses some myths regarding that. So, check out our website at sunshinesmilesoc.com and check out our blog section. And, of course, if you have any questions regarding Invisalign, I'd be happy to, do a consult. And we offer free orthodontic consults to take a good look at your teeth and see if you're a good candidate. But thank you guys for watching, and have a wonderful day.